Our next question is from Natasha Robinson from The Australian, also commended earlier in the Health Journalism Awards. Congratulations, Natasha.
Thanks very much. Hi, Minister. You've talked a lot since you've been Minister about the crisis in general practice, how it's never been harder to see a doctor, that people are paying more gap fees than ever. How will this package that you're announcing in the budget and the reforms that you're instituting over the next few years solve the fundamental problem that the rebate is now so low that it just doesn't, cover the cost anywhere near the actual cost of seeing a doctor, and also, it causes the problem you've also talked about a lack of attractiveness in going into the professions. While your reforms are really welcome, aren't you going to be still left with this problem going forward, at least in the next few years?
Thanks, Natasha. I tried to stress that there's more in the budget in health. There's more in the budget that reflects our strengthening Medicare agenda. The issues or the items that the Prime Minister took to National Cabinet were items that we thought would be a productive discussion between state and territories. Often we'll want their cooperation, for example, in the identification of the frequent flyers in hospitals. So there is more to come. We're very conscious of the financial pressure that particularly general practice is under. I've talked a lot about that, and we've been thinking very carefully through ways in which we can alleviate that financial pressure. We can't undo sort of several years of Medicare rebate freeze in one fell swoop. That's difficult, obviously, but this is our most important priority. I've said that from the time I was appointed as Health Minister. I have no higher priority than rebuilding general practice. It's part of relieving some of that pressure today, but as you point out, and you've written about this, Natasha, it's also about rebuilding the attractiveness of general practice as a career for our young medical graduates. You know the stats, 14% of medical graduates now are choosing to go into general practice. Used to be 50%. So if you think it's hard to get a GP now, 5-10 years down the track, if we haven't turned that around, we're going to be in all sorts of difficulty. And the general practice being the backbone of our healthcare system means that would reverberate right through the broader health system, particularly into our hospitals. So we'll have a comprehensive look at this. I think improving the attractiveness of general practice for young medical graduates, I've talked to a lot of young doctors through the AMA, through the college, just anecdotally, is not just about money. I mean, yes, it is about money a bit. It's also about culture. It's also about the respect that general practice attracts from their governments, but also others in the health sector, including, frankly, some of their supervising physicians in hospitals. So we're going to have to look at this quite comprehensively, but rest assured that there is no higher priority for me than rebuilding general practice, because it is in the worst state, certainly I think it's been in the 40-year history of Medicare.